Hello students, welcome to the presentation on biotransformation and excretion of a drug, which is a continuation of the pharmacokinetic topic. Learning outcome of this video: after watching this video, students should be able to define biotransformation, explain the phases of biotransformation, define excretion, and describe various channels of drug excretion. Biotransformation is also known as a metabolism. What is biotransformation? As we have discussed earlier, that to produce any desired effect, first step is that drug should get absorbed into the blood in unchanged form. After absorption or after getting access within the blood, it get distributed throughout various compartments of a body and at the site of a action. During this distribution, drugs get metabolized or biotransformed. So what is this biotransformation? As name indicate, biotransformation means biological conversion of a one form of a drug into another form, or we can say that it is a chemical alteration of the drug in the body. Means any change in the chemical structure of the drug inside the body is called as a biotransformation. And why this biotransformation method is essential? What is the significance of this biotransformation? Its aim is that it converts the non-polar lipid soluble compounds into more water soluble compounds that they are easily excreted. Means opposite to the absorption. Generally, water soluble drugs means hydrophilic drugs are less biotransformed and is excreted as it is, that is unchanged form. Biotransformation also protect our body from toxic metabolites. Now my next question will be that where the biotransformation occurs. Which are the sites of biotransformation? Biotransformation caused by the microorganism present in various tissues. Primary site of drug metabolism is liver. Majority of the drug get metabolized in the liver. Drugs which are administered orally, all these drugs get metabolized in intestine or in liver. After the liver, in descending order, other sites of drug metabolism are lungs, kidney, intestine, placenta and skin. Biotransformation results into active drug to inactive metabolite. Means in vitro, that is outside the body, drug is active and after administration into body, it undergoes the biotransformation and converted into the inactive metabolite. Metabolite means nothing but the final product produced during the biotransformation or metabolism. Some of the example mentioned here: ibuprofen, paracetamol. Second result of biotransformation is that active drug to active product. Means here both in vitro drug is inactive and in vivo its a metabolite is also active. Means active drug undergoes biotransformation and converted into metabolite which is again active. So result or whatever effect is produced due to the sum total of these two products, that two active drug and active metabolite. Example, phenacetin is a drug converted into active metabolite like acetoaminophene or paracetamol. Similarly, morphine is the analgesic drug which is converted into active metabolite morphine 6-glucuronide, and analgesic action is due to both these morphine and it's due to its metabolite. One another result of biotransformation here: inactive drug to active metabolite. Means in vitro outside the body drug is inactive form, but after administration it converted into active metabolite. Such type of a drug are called as a prodrug. Means outside the body drug is inactive, but after administration it is converted into active metabolite which is responsible for action. Example, use of a levodopa in treatment of Parkinsonism. Here levodopa is converted into dopamine metabolite. So anti-Parkinsonism effect is due to the dopamine and not due to the levodopa. So levodopa is called as a prodrug. And biotransformation also results, that is less toxic drug is converted into toxic metabolite. Isoniazid is one of the antitubercular drug, is undergo biotransformation and converted into acetyl isoniazid, which is a toxic metabolite. Whatever chemical reaction takes place during the biotransformation, it is categorized into two phases. First phase is the phase 1 reaction called as a synthetic reaction or non-synthetic reaction, in which the polar groups are introduced to make drug water soluble, and the metabolite which is produced may be the active or inactive form. Reaction involved during this phase 1 reactions like oxidation, reduction, hydrolysis, cyclization and decyclization. Second phase is the phase 2 reaction called as synthetic or conjugation reaction, in which highly water soluble conjugates are produced, which are easy to excrete from routes of drug excretion like kidney. In this type of reaction, there is covalent attachment of a small endogenous molecules like glucuronic acid, glutathione, glycine to drug or phase 1 product formed in the phase 1 reaction. And these metabolites formed this reaction are generally inactive type, and reaction involves this type of metabolism is the glucuronide conjugation, acetylation, sulfate conjugation and methylation. Phase, whenever drug is given, it undergoes the phase 1, that is non-synthetic reaction, takes place by the oxidation, reduction, hydrolysis, etc. Product is the active metabolite or inactive. And again this metabolite, active drug or active or inactive metabolite undergo phase 2 reaction, forms, that is glucuronide conjugation, and that conjugated product easily excreted outside the kidney. Hope so you will understood, you had understood about the metabolism of the drug. Now move towards the last pharmacokinetic process, that is excretion. Excretion is also called as elimination. What is the meaning of excretion? It is a process by which drug or their metabolites are irreversibly transferred from internal to external environment, or we can say that passage out of systemically absorbed drug. So after producing action, there is no use of that metabolite or the drug now inside body. If they are remains in for prolonged period within the body, they may cause the toxicity. So it is necessary that after producing action, that drug or metabolite should be get excreted any suitable route of excretion. There are drugs get excreted by number of routes or channels. Here we have mentioned the channels of route excretion: kidney, bile, intestine, lungs, skin and saliva. And last one is the mother's milk, through which drug excreted outside the body. Let us discuss one by one. Kidney is the principal organ of a drug excretion. Majority of a drug get excreted by the kidney in form of a urine. All water soluble drugs and their metabolites get excreted by the kidney, and process involved in the elimination are passive glomerular filtration and tubular secretion. If renal function is impaired or any problem, then concentration of drug inside body increases and prolongs the drug effect, which may result into toxicity. Generally, excretion of a drug by the kidney or urine depends upon the pH of urine. Remember that acidic drugs are excreted fastly through the basic urine or alkaline urine, and basic drugs are excreted from the acidic urine, and this fact is considered while treating the poisoning cases. Another route of drug excretion is the lung. Generally, volatile drugs and general anesthetics and its metabolites get excreted by the lungs. Example, alcohol and volatile general anesthetics. Alcohol is excreted by lung and its smell through the breath. We can easily detect it. It's a route of a excretion. Next channel of route of excretion is the intestine. Here, drugs are excreted from intestine in form of a feces. For example, purgatives like senna, cascara and sagrada are excreted by the intestine in form of a feces. Also, heavy metals get excreted through the feces after its absorption. Skin. The metalloids like arsenic and lead are eliminated by the skin in minute quantities in form of a sweat. So, it is the reason behind occurrence of the skin rashes, that is repeated elimination of these metabolites through the skin. Saliva. Only certain amount or minute quantity of a drug get excreted through saliva. Saliva is the secretion of salivary gland in the mouth. Example of a drug get excreted by saliva is the iodide. Bile. Bile is the secretion of a liver, that is bile juice. Those drugs are highly lipid soluble and their metabolites are excreted in the bile juice. And from bile juice, it is excreted in intestine and finally they are excreted in form of a feces from intestine. Some drugs also when enter into the intestine from bile juice again reabsorbed back into the liver via portal vein and again secreted into bile and from bile again into intestine. This is called as a enterohepatic circulation. That is from intestine to liver and from again liver to intestine, and drug undergoes enterohepatic circulation, shows the prolonged duration of action. Some of the drug get excreted by this route are the antibiotics like erythromycin and novobiocin. Mother's milk. Mother's milk, excretion of a drug from mother's milk is not important for mother, but should be considered while in case of a suckling baby, that is a feeding babies. Drugs excreted through the mother's milk may cause the harmful effect to breastfeeding infants as they fully depends upon the mother milk. So precaution should be taken while prescribing the drug in lactation period, that those drugs are excreted in mother's milk. So these such drugs are precautiously administered in the lactating period, which will affect on the fetus, which will affect on the infants. Examples like antibiotic chloramphenicol is get excreted by the mother milk. One another antimalarial drug chloroquine, sulfonamides, barbiturates etc. get excreted by the mother's milk. So hope so you had understood about the biotransformation and excretion. So thank you for the patience listening. Happy learning.